Hi everybody, we're going to begin chapter 24 now, which is pregnancy and breastfeeding. Dental drugs associated with, here we go, this is what I meant to start with. Pregnancy and breastfeeding. The dental hygienist will see many pregnant or breastfeeding women. It's always important to ask this question of whether or not they're pregnant or may be pregnant, if there's a chance that they're pregnant, before you begin treatment of people within the childbearing age. So check and see what the office policy is in your office, but I've always started at about age 16. I know it could be earlier than that, but you just want to be sure that you give them the best treatment possible. One situation I ran into was in the oral surgeon's office. A young lady that was pregnant but hadn't told her parents yet that she was pregnant. We couldn't sedate her. So we were kind of in this catch-22 where we knew she was pregnant, but she wasn't ready to tell her parents yet. But we couldn't treat her, so we couldn't tell them why we weren't treating her. And we just said, you and your daughter need to talk. And they left, and hopefully everything turned out okay for them. But it is kind of a tricky area because of HIPAA, and when you don't treat somebody that was expecting to be treated, their parents were expecting to be treated, it can be very tough, a tough situation. Also, I've had patients that have said they were going to have an abortion, so it didn't matter. However, you never know if they're going to change their mind, so you want to treat them as if they are carrying out the pregnancy, okay? Often pregnant women require additional dental treatment because of their fluctuation in their hormones. You'll see more bleeding gums in pregnant women because of their hormone levels, and also women in going through menopause. The dental hygienist can help prevent unnecessary drug administration by carefully questioning women of childbearing potential of their pregnancy and lactating status. Teratogenesis is the production of a deformity in the developing embryo or fetus. We now know that certain drugs can pass the placenta barrier and affect the fetus. Teratogenicity. One, it's difficult to identify due to different animal species and humans varying amongst themselves in the response to drugs. So what may affect one person may not affect the other. Same thing goes with their unborn child or fetus, however you want to refer to it as. So you just don't know. The timing of the drug and exposure varies with each drug. Some are more dangerous in the first trimester, some are better usually they aren't so good in the first trimester because that's when all those cells are differentiating and multiplying. And then some you have to wait till the third or wait till they're completely done at the third trimester, or wait until they're completely done with their pregnancy. One drug can produce a variety of abnormalities, and different drugs can produce the same abnormality. Drugs that are teratogenic are not uniformly so. A drug's effect on the fetus may be different from its effect on the mother, so that's where it gets really tricky. The teratogenic effects of a certain drug on the fetus may not be evident for many years. So breaking it down into trimesters, the first trimester is the formation of the organs and is the most critical for teratogenicity. So you would want to avoid x-rays in that first trimester. The women often get morning sickness, and if it's bad enough, you will see some erosion on their lingual surfaces. And elective treatment should be avoided during that first trimester. The second trimester, go ahead and do the prophylaxis, evaluate the patient's perio status, and the patient is most comfortable during this trimester. The third trimester, the patient feels much more uncomfortable. They may be in premature labor. And dental treatment you want to do with them sitting up or with them on their right hip elevated. FDA pregnancy categories, we should know these by now. We just reviewed them in class last week. So A is low risk. B is no studies on humans, but animal studies show no risk to the fetus. C, adverse effects demonstrated on animals, but no data on humans. D is that there is evidence of human fetal risk, and X is fetal abnormalities in animals and possibly in humans. So category A, things that fall under that are vitamins and thyroid supplements. B would be acetaminophen, penicillins, and opioids, and also the use of lidocaine. C is epinephrine, aspirin, and atropine. Category D, we're getting into the more serious categories now, is tetracycline, warfarin, and diazepam. Category X is isoretinoin and triazolam. Now, talking about breastfeeding, drugs without strong indications for use should not be given. Basically, you just don't want to give the nursing mother anything that isn't necessary. Almost all drugs given to the mother can pass through the breast milk in varying concentrations. The amount of drug that appears in the milk depends on the plasma concentration of the drug, the fat solubility or lipid solubility, the degree of ionization, and binding to plasma proteins. So just going over some of our main dental drugs, local anesthetics. Epinephrine all by itself has an FDA pregnancy category of C. Lidocaine and prilocaine are category B. So it's not the epinephrine isn't by itself. Bupivacaine, mepivacaine, and procaine are all category C. And then here it addresses the epinephrine again, where it says small doses are similar to those produced endogenously, so about the same as what the body produces, so it really isn't going to do any harm. But large doses can produce adverse effects. Of course, large doses in a healthy individual can cause adverse effects also. Analgesics, the lowest possible dose and the shortest duration is what we're aiming for. So aspirin is a category C. It is not safe. Studies in animals, they see a variety of birth defects to the eyes, the central nervous system, the gastrointestinal tract, and the skeletal system. Pediatricians recommend not using during breastfeeding or in young children because of the bleeding and because of asthma. NSAIDs or NSAIDs are not safe, again, just like the aspirin. They produce effects similar to aspirin, delayed or difficult delivery if given during the third trimester. Pediatricians feel ibuprofen is safe for breastfeeding mothers, and they also feel that it is safe for very young children. Not really young. They recommend Tylenol up to, I want to say 6 months or a year, and then ibuprofen. Acetaminophen is a category B, so very safe. If toxic doses are given, it can be harmful to the liver in the newborn. You know, we've talked about the toxicity of acetaminophen previously, and you just really want to be careful not to damage your liver or the newborn's liver. So be very conscious of that when recommending acetaminophen. Always tell your clients or your patients to follow the bottle as directed and to always read the bottle because it does come in varying doses. Opioids, FDA category C. They're associated with cardiovascular defects, cleft palate and lip, or dislocated hips. Near-term administration can produce respiratory depression in the infant, so very scary. It can appear in breast milk, but small amounts appear to be insignificant. So don't be afraid of it, just don't let them use it in large amounts. The infant should be observed for signs of sedation and constipation if the mother's taking it. Anti-infective agents, penicillin is category B. It's safe to use during pregnancy. It does appear in breast milk. Infants should be observed for signs of diarrhea, candidiasis, and allergic reaction. Erythromycin, category B, considered to be safe to use during pregnancy. It is concentrated in the breast milk, but really produces no problem. Cephalosporins, again, a category B. First and second generations have not been associated with any teratogenicity. Tetracycline is our antibiotic that is a category D, so it's contraindicated during pregnancy. It does cross the placenta, deposited in the fetal bone and teeth. That's why we will see the modeling of the enamel. Stained deciduous teeth. Fetal bone growth is inhibited, and it is present in breast milk. Clindamycin is a category B with no adverse fetal problems reported and can be used during pregnancy for anaerobic infections not sensitive to penicillin. It is present in breast milk and monitored for diarrhea. Metronidazole is a category B. Produces category B generally, but is contraindicated. Produces birth defects in animals. Should be used carefully during the first trimester. The nursing mother should only be given metronidazole if the breast milk is expressed and discarded during treatment and for 12 to 24 hours after the last dose. I just want to check that pregnancy category. I'm using, again, somebody else's slides, and I just want to be sure that we are on the right track here. There's our cleft palate. Let's see here. Sorry about this, you guys. I just want to be sure. Metronidazole. Yes, but you use it with caution. Just getting rid of the breast milk, I guess. Okay. So, let's see here. Okay, thank you for bearing with me there as I just double checked that. It just didn't look right on here. Okay, so then we have nystatin, and this is more the antifungal, and it is a category B. It's safe to use during pregnancy. It does not get absorbed systemically and can be used by the pregnant woman or the nursing infant to treat thrush. Clotrimazole is also a category B. No abnormalities have been reported, and the use of nystatin is safer than the clotrimazole. So generally they'll use nystatin. Ketoconazole is a category C, so this is our last choice, and appears in breast milk and may produce jaundice in the nursing infant. If ketoconazole must be used, breast milk must be expressed and discarded during therapy and for 72 hours. So we're looking at 3 days here. Our anti-anxiety agents, most commonly used in the dental office, is the nitrous oxide. Very dangerous. It can cause spontaneous abortion and birth defects. Pregnant women should have knowledge of the levels of nitrous oxide in the office they are working in. And related to male and female exposure. So this isn't just women of childbearing age, it's men who are with women of childbearing age also. Benzodiazepines are a category X. They are not safe during pregnancy. They can cause cleft lip and cleft palate or neural tube defects. The indication during pregnancy only for treatment of status epilepticus, so when the mother's life is in danger, is about the only time that they'll use it. And use in the nursing mother causes sedation and feeding difficulties in infants. Barbiturates are a category D. They're associated with minor congenital defects. Phenobarbital and other barbiturates can be given to nursing mothers, so you want to observe the infant for signs of sedation. Fetal alcohol syndrome, you'll see abnormalities in 3 areas. One is in growth retardation, CNS abnormalities, and facial morphology. Pregnant dental patients should be encouraged to abstain from ingestion of alcohol throughout their pregnancy. So prior to giving a medication to a pregnant woman, dental hygienists should review their medical history thoroughly, consult with the dentist, and also remember to consult with the physician. That's it for Chapter 24.